Welcome to another episode of Vital Signs. Today we're diving into the future of employee health benefits and why wellness is no longer just a fruit bowl in the boardroom, but a business strategy with real measurable consequences. We're also unpacking the one thing that no algorithm can ever replace, the deep human connection that keeps people engaged, resilient, and thriving. I'm joined by Dr Mosima Mabunda, Chief Clinical Officer at Discovery Vitality, an expert who has plenty to say about where workplace well-being needs to go next. Welcome so much and welcome back to the show.
Thank you for having me.
So what we want to talk about today is, do you think companies are doing enough to not just provide healthcare benefits, but to keep people thriving?
Thank you for asking that question. I think one thing I want to start by acknowledging is organizations are prioritizing or trying to prioritize employee health. I think this is even more so since the COVID pandemic, where many of the organizations that we speak with talk about how they are or are wanting to prioritize employee well-being. So certainly this is something that is topical within the employee or the organizations in general. But having said that, I think there's still more that needs to be done and that can still be done. And the reason I say that is threefold. One, from a physical health perspective, the prevalence of chronic conditions is high and is still rising. Things like obesity, diabetes, cardiovascular diseases such as hypertension, they remain rife, right? And if they are high in the population, it means they're high within the employee population base. And from a financial health perspective, many of us are likely to retire with not sufficient income. And we know we're living longer, right? That is problematic. And thirdly, again, from a mental health perspective, the prevalence is high and it's increasing. So though organizations are aware that employee health is important and they are prioritizing it, the burden of disease from a physical and mental health perspective and just our substandard financial health suggests that there's still more that needs to be done.
So having worked in this industry, companies always ask, what is my return on investment? How do I know that the money I'm putting in is actually going to pay me dividends in the long term by looking after my employees?
I love the question because one thing with any program or intervention that you implement, you have got to evaluate it. Intervention evaluation is key, and it also helps distinguish genuinely science-based programs that will deliver outcome versus programs that are not so robust. So I think the first thing is intervention evaluation is a priority and is important. And how I would say one should think about it is twofold, right? Thinking about your lead indicators and your outcome indicators. It's important from a lead indicator perspective to be on top of the uptake of those programs or interventions that you have. How many people are screening? How many people are participating in the physical activity interventions that you have in place, for example? So it's important to stay on top of that and know that people are engaging on an ongoing perspective. But similarly, you want to know, because ultimately it's those lead indicators that ultimately leads to the outcome. You also then want to track, are you actually seeing the outcomes that you're supposed to be seeing? And I think an easier one to track is if you look at absenteeism and sick leave, and you also equally look at employee turnover. That should give you an indication that these programs are actually leading to those outcomes. And the reason I say that, I'm going to share some of the stats from our data from Discovery staff, for example. We've seen that those individuals with a body mass index, a BMI that is within range, or their mental health score that is within range, they have 40% lower sick leave, right? So for me, that's important to highlight because it shows that if you invest in appropriate interventions that work and your employees see the right outcomes, ultimately, you are going to have lower sick leave, lower absenteeism, which is quite critical because you want people that are there that are healthy and thriving so that they can deliver on the mandate of the organization.
So you can provide, I'm actually being diverted off topic here. I think it's actually within the topic. So we can provide all sorts of solutions for people. We can teach them about sleep, about mental health, about why they should go to the gym, how they should eat right. What does it take to get a person to convert those behaviors?
So critical question that you ask, because education is important. It is powerful, but it provides information. And we know from behavior science that it is not sufficient to actually sustain behavior change, which is why we do what we do and we do it the way we do it. I'll give you an example, which is what our primary recommendation is. The first step, speaking from an organizational perspective, is it is far much better, and the data shows it, to actually embed this program within your employee benefits, right? Because then when you embed it in there, you've got a structured program that spans across health, finances, risk, EAP, etc. And if you've got a program that's evidence-based that shows results, you're able to help your employees through the program. They can set micro goals, they can get incentives, they can be part of communities that help them go on the journey. They can access resources that actually take them. Like the most recent example for me is with the corporates and employee benefits division. They came to all of our staff, and I was one of them, to just ask about retirement. It was Women's Month. Ask about retirement. Like, have you saved enough? Do you think you'll be okay? I'm like, of course I'm okay. They're like, oh, okay, let's just open and see. And I went in and I'm like, not as well as I thought, but thankfully it was something that was fixable. So when they took me through the breakdown in terms of how one thinks about not even like setting the right expectations for retirement, which was primarily where I had a flaw, setting the right expectations because the financial demands in retirement are not similar to financial demands today. Thinking about how you balance your contributions, etc. I actually realized that I'm not too far off, but I would have been had I been on the trajectory that I was on. So having those programs embedded and having teams that actually are invested in taking employees through those, for me, is key to actually developing those sustainable behavior. And I wanted to share something with you just to give you an example of the impact that we've seen in organizations that have embedded this across the board. So for example, from a financial perspective, we've seen that members save at least more than 85% in interest repayments. That is big. That's an unnecessary thing that like one doesn't need to expend the expenditure in. And we've seen a higher uptake in mental health screening and in physical health interventions. Many corporate wellness interventions, one of the things that they suffer from is low engagement, right? Where sometimes you have things and people would be like, but no one actually participates in these things. And we see that because of the organized structure, the incentives that are embedded in there, the structure that we have of gamifying engagement in those programs actually lead to engagement. And as a result, your productivity goes up and some of those metrics actually end up tracking high. I think what I want to leave individuals with is behavior change sounds simple, but it's not as simple. It needs to be systematic. There's a couple of things that need to be in place. And if you don't have the right resources, I think it's better to engage individuals who are well versed in doing that, or outsource it to someone who actually is an expert in doing that so they can support you in achieving the goals that you want, which is for your employees to be healthy.
I love that. And I love how you said people came in and spoke to you, because that human engagement is actually the most important thing at the end of the day. And we can be accountable to an app, but we are more accountable to each other. I love that.
Yeah, no, 100%. Because I love technology. It's revolutionized behavior change. It has allowed us to scale interventions. It's actually given people a much more nuanced understanding of how their health is. But I completely agree that it is an and. Right, it is an and, definitely. Yeah.
Dr. Mabunda, thank you so much for joining us again today. It's been an absolute pleasure, as always.
Thank you for having me. It's been an absolute pleasure from my side as well.
Thank you. If there's one takeaway from today's conversation, it's that healthcare benefits are the backbone of a high-performing workforce. When companies invest in preventative care, smarter benefits, and real human-centered support, people don't just stay healthier, they show up with more clarity, more energy, and a whole lot more loyalty. If you want a competitive edge, start by taking care of the humans who keep your business alive. That's all we have time for this week. This is Vital Signs, the business of working well.